In this section, you will learn what hyperlipidemia and atherosclerosis are, observe how lipids are transported around the body, and see why atherosclerosis increases the risk of diseases such as heart disease. Hyperlipidemia is defined as an increase in blood concentrations of lipids, more commonly termed fats. Lipids are molecules that share a common property of not being able to dissolve in water. Cholesterol and triglycerides are two types of lipids found in the blood, and either or both of these lipids are raised in the blood in hyperlipidemia. In atherosclerosis, lipids deposit in the lining of the blood vessels, making the blood vessels harder, thicker, and less elastic. Here you can see the progression of atherosclerosis in a blood vessel, which normally begins from an initial lesion. With continued hyperlipidemia, there is an increased chance of the progression of a fatty streak, which is when lipids accumulate in the blood vessel wall. Ongoing hyperlipidemia can then result in small fatty lumps that appear in blood vessels. Here we see atheroma formation as indicated by the fats in yellow starting to make the blood vessel narrower. As the build-up of fat continues, the disease worsens. This means that blood flow can become obstructed and parts of the deposit or the plaque that forms in the blood vessel can break off and block a blood vessel elsewhere. Because of this, atherosclerosis can result in a number of serious conditions. In the early stages of atherosclerosis, the person will not have any noticeable symptoms. With time, however, the accumulation of the plaque can cause fibroatheromas and complicated lesions which can impede blood flow. Also, plaques may rupture and lodge temporarily in smaller blood vessels to cause a number of conditions. Claudication is the result of a lack of blood flow to the legs, causing pain and limping, particularly when walking. Angina is a pain in the chest that occurs as a result of not enough blood, and therefore not enough oxygen, getting to the blood vessels within the heart lining. Not enough oxygen to tissues is called ischemia. A transient ischemic attack, or also called TIA, is caused by a temporary cut in the blood supply to the brain. A person that has a transient ischemic attack is at greater risk of having a heart attack or a stroke. If a plaque or a thrombus completely occludes a blood vessel, this may cause a heart attack when blood flow to the heart is blocked, or a stroke when blood flow to parts of the brain is blocked, and possibly death.